Just so excited to welcome everyone to our Resilient Georgia General Meeting. The topic today is Building Resilient Futures, Youth Mental Health in Action. So I'm Audrey Ede-Cotter, and my colleagues Alex English, Nikki Warner, and I work to amplify the work of our regional coalition partners as they lead meaningful change in their communities. So please feel free to introduce yourself in the chat if you haven't already, your name, your organization, and where you're joining from today. And we'll also be using Menti, so please feel free to also join the interactive pieces on menti.com. So this is our second Regional Coalition Showcase this year, and we're so excited for our partners to share their work with you. This meeting will spotlight 6 of our Regional Coalition partners who are helping young people build their resiliency toolbox. So this is in youth, as well as building the foundation from a very young age. Our partners are also ensuring that adults in their lives have the skills to support them in meaningful and trauma-informed ways. So this includes teachers, caregivers, coaches, and mentors. So just as importantly, these coalitions are also creating the space for young people to lead, shape solutions, and use their voice to guide their communities. Before we dive into the Regional Coalition presentations, the team would like to take a moment to share just a little bit about Resilient Georgia and the work that we're doing across the state. We are a coalition of more than 900 partners and stakeholders across the state working to prevent childhood adversity and promote resilience. The 3 pillars of our work are to convene and connect, celebrate and share innovation, and remove barriers. So today's meeting is one way we connect partners across the state, and we encourage you to follow up with our presenters to learn more and continue the conversation. We also want to shine the light on what's working in the state. So our website features research briefs, statewide scans, and resource lists, and showcases like this, which lift up the innovative work happening across the state. And we work to clear the path. Sometimes that means policy advocacy, and sometimes it's as simple and meaningful as connecting partners who can support each other. So I'm going to hand off the meeting now to Nikki Warner, our Regional Program Manager, who will share more about the regional coalitions.
Thank you so much, Audrey. My name is Nikki Warner, and I'm excited to be here with you all today to share a little bit about our regional coalitions. So we have 19 coalitions across the state of Georgia, which is very exciting for us. We just launched our 19th coalition a couple weeks ago, and so now we are covering 146 counties in the state out of 159. So we are across 90% of the state, and we hope to cover the whole state very soon with our 20th coalition. Each region has developed a robust public and private collaborative of partners and are deeply engaged in their work to reduce mental health stigma, prevent and heal childhood adversity, emphasize trauma-informed awareness and care, and promote system of care coordination and resilience in children and families. So they do this through providing education and training, teaching opportunities, supporting workforce development across various sectors, advocating for and strengthening policy, and engaging in research. And really our overarching goal is to work towards this policy systems and environmental changes in our state. So just as we connect partners that support mental and behavioral health statewide, the regional coalitions do the same for their catchment areas. And so you can see our updated map here with our 5 rounds. Everything is beautifully color-coded, and it's just so wonderful to see this work growing across the state. If you want to learn more about the regional coalition work, you can check out the regional summary update report that we'll put in the chat, as well as our coalition website, our new coalition website that we're really excited about. So feel free to check that out, peruse the report, peruse the website, and kind of learn a little bit about what's going on. And then also we will be publishing our 2025 summary update report next month. So stay tuned for that so you can see the updated information. So now I will go ahead and pass it to my colleague, Alex.
Hi, everyone. Thanks for being here today. I'm Alex English, Regional Senior Program Coordinator here at Resilient Georgia. why we're all here today and what we're talking about is youth mental health. So I think it's important to kind of point out some of the data around the state of youth mental health in Georgia. So this slide just gives us a snapshot of the state of youth mental health, which really highlights both our progress and our ongoing challenges. So if you look at the map, you'll see that Georgia ranks 13th in the nation for youth mental health overall, according to Mental Health America. That is very encouraging. It means our young people are showing signs of resilience and that prevention and early intervention efforts are having an impact. But when we dig a little deeper into the numbers over there on the right, we see a very different story. Nearly half of youth ages 3 to 17, so about 47%, report having difficulty getting the mental or behavioral health care that they need. So that tells us that access remains a huge barrier, especially in rural and under-resourced areas. We also know that around 159,000 Georgia adolescents experience a major depressive episode each year, and more than 60% of children with identified mental health needs still receive no treatment. So even when needs are recognized, families often can't get connected to timely or affordable care. The most sobering statistic is that suicide is now the second leading cause of death for young people ages 10 to 14 in the state. And those deaths have increased by 35% in just the past 5 years. So while we're seeing strong youth outcomes in some areas, these numbers remind us that our systems haven't fully caught up to the needs of children and teens. So this is why the work our coalitions and partners are leading are building the trauma-informed, accessible, and connected communities is so very critical. So as we think about these statewide trends, it's inspiring to see how these 6 regional coalitions and partners are stepping up to respond. So to kick off our regional coalitions showcase, I'm excited to introduce Resilient Northeast Georgia, represented today by Ms. Stephanie Mann and Anna Kate Robinson from the Athens Area Community Foundation, and Sherry Deacon with the Madison County Family Connection Partnership. Pass it over to you, ladies.
Good morning. I'm Stephanie Mann, and I serve as one of the coalition leaders for the Resilient Northeast Georgia Coalition. And our coalition serves 12 counties in the Northeast Georgia area. And today from our coalition, you'll hear how we're serving youth throughout our region, from Sherry Deacon about an initiative they brought to their community, and from Anna Kate Robinson on how our community foundation is engaging youth through philanthropy. I wanted to briefly introduce you to our coalition's full leadership team and thank them for their work. We wouldn't be able to see the impact we see throughout our region without each of these 3 ladies who have given so much to our coalition. I want to start by giving a big picture view of how our coalition as a whole is supporting youth well-being throughout our region and many partnerships. Our anchor partner is Family Connection Region 5. And in each county, coordinators are leading locally and letting their communities drive the resources and supports initiated within each of their counties. And so many of them are overseeing incredible youth programming that I'm excited for you to hear a little bit more about today. On a statewide level, our coalition has begun a partnership to bring QPR and mental health first aid trainings across campuses to prevent suicide and arm students with skills that they need to support their peers. And then regionally, through our new Trauma-Informed Communities grant program, we are funding local nonprofits and helping them embed trauma-informed practices to their work. You can see some data points to the right of the slide that's from our Athens Wellbeing Project 4.0 data. This is a household level data project that's been happening for a decade here in Athens. And we know that these statistics for Athens, Clarke County are very similar for the counties throughout the region we serve. And you can learn more about the Athens Wellbeing Project through their website. But we wanted to highlight some of the data that the 4.0 revealed for our community and how many of our community grant partners are meeting that need, specifically focused on youth. And so one of the data points that we were looking at is childcare and how many families in our communities are relying on grandparents to support childcare needs. And so one of our grantees is the Athens Community Council on Aging, through their Grandparents Raising Grandchildren program, being able to bring Connection Matter training to grandparents in our communities. We also see trending data over this decade, data projects showing increases in depression and anxiety and the number of households without mental health care, which you heard Alex already talk about across our state. And one of our grantees is bringing resiliency skills and curriculum to their youth programming to help address this issue for youth ages 6 through 17. And then another statistics particularly interesting around COVID and after COVID that we incorporated into this survey. You can see that 47% of households experience the death of a family member or a close friend. And so one of our grantee partners is Kate's Club. And so they're expanding their programming in schools to help children cope with grief. And so these are just three highlights of our grantees that really tie into data that are serving youth directly. And we're really excited that our coalition can reach the region and local communities as well as statewide. We have a question for you on the next slide. If everyone can drop in the chat or through the code that you see on the screen, on a scale of 1 to 5, how equipped do you feel your community is to support the youth mental health needs that you see? And everyone can take a couple seconds to respond now. Lots of similar answers. And what we're excited about is for you to continue to hear throughout today's presentation, really tangible examples that you can see being done in other communities and see about bringing to your own community. And on that note, I will introduce Sherry Deacon from the Madison County Family Connection to talk about an initiative they brought to their own community.
Thank you to Stephanie and Resilient Georgia for the opportunity to share about our youth development event. For those of y'all that don't know where Madison County is, it's located just outside of Athens. We are still considered a rural county, largely in part because of our wonderful ag community. Of course, and with that, we have our normal youth-related challenges found in a rural county. In an effort to address some of these challenges, we decided to host a block party for high school students. We borrowed the idea from my Family Connection counterpart in Jackson County. The block party is actually a teen resource fair in disguise. We hold our Red Raider block party, as we refer to it, at the end of the school year. The party helps provide positive activities for teens to engage in over the summer. Some of the activities include jobs, recreational activities, and volunteer opportunities. And of course, there are teen-related resources that are shared that can be accessed year-round. The picture included in the slide is from our 2024 block party. Students that attended the previous year's party requested that we include more mental health resources. So as a result, we granted their request and added additional mental health resources and decided to take advantage of Resilient Northeast Georgia's offer to bring Hope Givers to Madison County. For those of y'all that aren't familiar with Hope Givers, it's an Emmy Award-winning PBS series that focuses on youth mental health. It was founded by Tamalin Hall, a Georgia native. The program offers a curriculum that aligns with Georgia DOE standards, and they also offer a Hope Givers live event. The event it's typically held during the school day as an assembly. However, we opted to include it in our block party, which is held directly after the school day. The rundown of the show is included in the middle portion of the slide. And if you can see it, You'll notice that there are various mental health resources included in several segments of the show. One of the segments included the concept of a trusted adult. And of course, this concept is taken directly from the Sources of Strength prevention model or program. And thankfully enough, we were actually blessed to have Sources of Strength in place at the school, thanks to the Council on Alcohol and Drugs. So as a result, the students were already familiar with the terminology, and we invited several trusted adults from the school to attend the block party. The show also included a segment with the Backpack Kid, who is a popular influencer from right here in Atlanta, Georgia. So if you're like me, I didn't know who that was, so I had to ask my tween daughter. She informed me that he created the floss dance, and we found that having him there helped to triple the prior year's attendance at the party. We also received positive feedback from students, resource table hosts, and school administration. You can see on the left there the party stats. We saw that students who completed an event survey indicated that they learned about a new resource, and 100% of them plan to utilize it. So just to share a little secret with y'all, we almost did not take advantage of the opportunity due to the time crunch of when we found out about it and when the block party was scheduled for. But we're so thankful we did. We're also thankful for Resilient Northeast Georgia for enabling us to bring such a great resource to Madison County. So my call to action for y'all is to take a chance on an opportunity like we did, particularly as you continue to grow and expand your programs. So now I'd like to introduce Miss Anna Kate Robinson, a Fall Fellow with the Athens Area Community Foundation. Thank you.
Hi, everyone. My name is Anna Kate Robinson, and I'm one of the Fall Fellows for the Athens Area Community Foundation. I'm so grateful for the opportunity to be able to speak with you all about our youth philanthropy and fellowship programs. And so before I begin to dive in about our youth philanthropy program, I thought it would be very helpful to share a statistic on why our work is so important. So there was a study that was published by the Oxford Journal that found a strong linkage between generosity and low rates of depression, an illness that affects more than 25% of all high school students. And so our youth philanthropy program provides an opportunity for students to demonstrate generosity, so inspiring continued and ongoing connections to resources, and it allows them to give back to their community. And so when asked about the program, a student leader shared with us that I loved learning about real nonprofits in our community and how these organizations are truly making a difference. Actually making a contribution was icing on the cake. And so just when you think the foundation stops there with empowering young leaders, it doesn't. And so I'm proof of that with the fellowship program. This fellowship takes that mission even further. And so there's 6 fellows each year that are immersed in different experiences like Reading Rabbit, watching the Trauma 101 webinar, and then also attending collaborative meetings across the state. So this role has really inspired me and continues to push me to think critically and just step into leadership with confidence. And it also reminds me that when we're able to give and equip young leaders with these opportunities, that's when we can truly make an impact for the next generations. And so with that, I would just like to say that I'm very grateful for this opportunity, not only to be a Fall Fellow with the Athens Area Community Foundation, but to be here with you all this morning. And then with that being said, I would love to hand off our program to our next speakers. So Christina Lennon and Jill Alexander from Resilient North Georgia.
Thank you so much for that introduction. My name is Christina Lennon with Wellroot Family Services and Resilient North Georgia. And Jill will be joining us in just a minute to talk about our Reaching Teens program. Resilient North Georgia focuses on 13 counties in the northern part of the state. The population centers for that group of counties are Forsyth County and Hall County. We have used Hall as our main hub of services, but do serve the entire region. So Resilient North Georgia is really looking at testing new trainings, testing new programs, building resilience through innovation and collaboration. We have 85 partners throughout the area that we've gotten to know over the last 4 years, and we are building a training kind of backbone for the area, offering several different types of training for different audiences, with the main goal of really looking at how a community could create a trauma-informed ecology for parents and children, and how very, very powerful it would be when every adult that a child interacted with thought, not what's wrong with you, but what's happened to you, and then had the presence of mind to say what needs to happen for you. And so that's really our big picture, to create a community where every teacher, every doctor, every first responder, every social worker really creates that community. And what that means is we need to build trust, and then communication skills and trust building skills within the community, as well as, of course, awareness. And so that's what we've been working on. We have a few signature kind of programs that we do, or that we've kind of taken on in this area. Triple P, Positive Parenting Program. We offer that to very distinct audiences. So it's become we've become very active in the juvenile court system, offering it to parents, and also in Head Start. Throughout the region, we do the community resiliency model to build tools for anxiety and resilience. We provide Connections Matter. Jill's going to talk about Reaching Teens, which is a model that we adopted from the American Academy of Pediatrics and has really become quite popular, moving beyond our region to the entire state. And a new one that we're going to work on this year called HOPE, Healthy Outcomes, Positive Experiences. There's more and more research that shows that positive experiences really act like an inoculation for future trauma, and we're digging into that big time. Just want to share with you our the work that we've done. If you'll move slides. So over the last year, this is kind of what it looks like in our region. We've trained about 1,900 people in these trainings over the last year, and over the last 4 years, about 6,000 people. You'll notice that while we've trained a lot in our North Georgia region, our trainings have quickly kind of headed all over the state. So we've touched actually 109 counties through Reaching Teens across the state, and also Texas, and one in Germany. So we're super excited to be international. Resilient North Georgia is now international, I'm going to turn it over to Jill to talk more about what Reaching Teens is and why we think it's so important. But first, I want to ask you this question. We think that building a trauma-informed ecology requires us to be able to communicate with all folks, right? And build trust. And we found that youth serving professionals find adolescents particularly challenging. I'm not sure if you would agree or not, but if you could put in one word or one adjective that you hear people talking about when they talk about teens. Resilient, moody, innovative, stressed. I have a senior in high school. He's definitely very stressed. Irresponsible, unsure. Lots of both good and lots of depressed, peer focused, different, creative. So there are typically, folks, I think sometimes adolescents get a bad rap, right? And Reaching Teens is really kind of breaking through that and saying, what do we need to be? What adults do we need to be the people that these youth deserve in their lives? And so with that, I'll turn it over to Jill Alexander, who is the manager of our Reaching Teens program. Jill is probably having trouble unmuting.
Sorry. So I was just saying, thank you, Christina. I appreciate that. Reaching Teens is super impactful to me, and it has truly, I have found my passion and my calling because in my own past, I had people speak into my life as a teenager that changed everything, my course of life. So when I look at Reaching Teens, which is a body of work by Dr. King Ginsburg and the American Academy of Pediatrics, they've partnered with us and allowed us to create a curriculum specifically geared toward people that have touch points with young people. So it's professionals, it's volunteers, it's whoever has an avenue to be able to reach and speak into a young person's life. And through that, we give people tools. It's a toolkit. And a lot of professionals are just overwhelmed with the day-to-day life. They're in it. And sometimes it's hard for them to take off to do trainings and to do all these things. But Reaching Teens, how we've molded this curriculum to be virtual, and we've designed it to be able to be taken in times when they can spare the time from the office to get online to take this curriculum. It's strength-based, it's research informed. So a lot of the things, the tools in Reaching Teens come from a lot of places that it's already been proven that it works. We take this toolkit and we give the professionals, the volunteers, whoever's on that day, the opportunity to really practice, to practice what it looks like using strength-based language, using active listening. And our program really reinforces trauma-sensitive practices and resilience building. It promotes respect because we know that it's only the young person that is the expert in their own life. It's their choices that they have to make the right calls in life. We can't do it for them. What we can do is walk alongside of them. And we can help them by knowing how do we phrase these questions? How do we talk to them and communicate with them without lecturing? How do we give them the space and an opportunity to build trust with us? At the same time, one of our most probably one of our most popular sessions of this training is where we can truly give them the professional self-care that they need. Because in order to help co-regulate any young person, we have to be ready to regulate and control our own emotions when we're dealing with these topics. And sometimes teens sometimes they can come in a little hot. So, all right, next slide. So one of our sessions, we really use the power of reframing. We want to look in the mirror at our own personal biases, how we're looking at young people. Do we see them as just entitled or whatever? So, and one of the other things that we're working on is also just how we reframe our language. When we're looking at this young person, we don't want to praise them on what they're creating, what they're, are they doing good enough? Did they make the A? We want to praise them for sharing with us. We want to give them the opportunity to say, thank you that, you're talking to me, you're sharing with me. So one thing that we say is, don't say, wow, I'm so impressed, or you must be so proud. Because guess what? When they end up not being able to hit that mark, they're not going to come to you. We want to create an environment where youth feel safe to come to the adults that are in their lives. So instead, we could say, you've really thought this through. Thank you for sharing your plans with me, or great perseverance. Tell me more. And then we lean in. We use our body language to really listen to that teen. So what we're also trying to do is create a replicable model. We don't want to gatekeep Reaching Teens. It's too incredible. It's a tool that really, we want it to be shared with anybody and everywhere that they want it. We want to share it. So what we've been doing is we've created a statewide summit. We had one last year. It was incredible. We had over 350 people in the summit, and who were honestly, the feedback we got were things like, this is the best summit I've been to in 20 years as a social worker, or I needed tissues. It was impactful. Dr. King Ginsburg comes. We're having another one, February the 26th and 27th. we want you to come. We've got a link that we can put in the chat for information. If you want more information, when we roll out the registration for that, we would love to send that to you. We've also been growing our virtual programming. As Christina said, it's already reached nationwide. We have multiple states engaged. Something else we've been doing, as you can tell here from the Reaching Teens Impact, the red in the state is where you see people that came from the summit. They even came from South Georgia to come to the Atlanta area for the summit. Our blue is people that have taken the virtual trainings and people that have taken the summit. They came to both. So, or just the virtual trainings. The purple is where they came to both. So as you can see from this map, we've made tremendous impact in the state of Georgia, and we're super proud of that. And I think I wanted to hand it back to Christina if she's still on. There was one thing about creating a replicable model about the evaluations and the advocacy plan, and she really could speak to the advocacy plan better than I can.
We just wanted to share that as we grow, we're really looking with intent on how we can grow not just the number of people trained, but a replicable model to put this forward and keep it as open access as possible, right? So that folks are able to access this information and it's affordable, right? So we offer virtual trainings every month. We offer an introductory series and then also deep dive series, and we offer again the summit where you can come and join us. So hopefully we'll be back in the future telling you how this has grown, but we're really excited and would love for you to join us on this journey. Thank you. And now we're going to pass it off to Rebecca Best with Resilient Communities of East Georgia. Sorry.
Thank you, Christina. And thank you to Resilient Georgia and to Audrey and Nikki and Alex for putting together today's general meeting and for inviting us to be a part of it. I'm Rebecca Best. I'm the Executive Director for Resilient Communities of East Georgia. We cover 14 counties in East Georgia. If you kind of carve out the letter C, that's us over on the east side of the state. 12 of our 14 counties are rural communities. And I'm here today to talk to you about the Resilient Teens program. Our Resilient Teens program is a skill building program teaching teens how to thrive even in the face of adversity. We strengthen protective factors like coping skills, caring adult relationships, and provide opportunities for teens for growth. Speaking of trusted adults, I wanted to ask who, when you were a young person, was a trusted adult in your life? For me personally, growing up, I had several close girlfriends. And for me, their moms were like second moms to me, and my mom was like a second mom to them. From getting dressed for school dances to helping with homework or rehearsing lines for a school play, those moms made a difference in my life, in addition to my own. And we can see that reflected in some of the mentee responses. I see grandmother, mother, teacher, specific drama and music teachers, coaches, camp counselors, youth advisors at church. Someone dropped in the chat, Dad's secretary. You must have spent some time at Dad's office and maybe had a trusted adult in his office that you were able to talk to and confide in and guide you. We know that having a trusted adult in the life of youth can change the trajectory of a child's life. And through our Resilient Teens program, we utilize near-peer mentors to for these teens to have a trusted adult in their life and help them identify people in their life that they can go to as trusted adults. Thanks for everybody for sharing in the mentee. I appreciate it. This is great. So we know the challenges that teens are facing. Alex highlighted the statistics that are very bleak and very grim. We know that these challenges ripple into every aspect of teens' life. And we know that not all teens have the same tools in their toolbox that they need to thrive and succeed and overcome adversity. And so our Resilient Teens model creates strong supportive relationships with near-peer adults. This This is through a partnership with the Medical College of Georgia at Augusta University. M1 and M2 medical students serve as coordinators and facilitators of our program. In addition, the curriculum is rooted in the 5 pillars of resiliency: self-awareness, mindfulness, self-care, positive relationships, and purpose. We want to encourage teens to develop these coping skills so that they can create positive environments, both at home, in their schools, and in their community, and foster a sense of belonging. These are some pictures from our annual Resilient Teens Summit. We had our second summit this past August. And as you can see, some of our teens, we got them up to the microphone. We had them in leadership roles. We wanted them to have meaningful participation. The summit is for them. And we involved them in the planning of the summit and then also in the execution of the day of the summit. And it's just a great opportunity for them to demonstrate the growth that they've experienced through participation in the program. And we also want to ensure that these youth have access to resources that help promote their mental, emotional, and physical health. Our program focuses on safe spaces for connection. So we target middle and high school students, 6th through 12th grade, in all 14 counties. The program is virtual. It's offered twice a year. It's 9 weeks long. And what's great is because it's virtual, parents don't have to worry about getting their child anywhere. We're able to reach our rural community partners and our rural teens. We're able to provide those teens through a partnership with Georgia Family Connection Region 7 with hotspots or cell phone minutes if they are having internet or connectivity issues. We have resources for that. We also have evaluation built in to every step of the program. Teens take a pre and post cohort survey, as do facilitators, and they also take a weekly survey on the session. You can see some images here of some of the medical students volunteering at our Resilient Teens Summit, as well as some of our youth engaged in an interactive activity at the summit. Over the past 5-6 years, we have covered over 700 teens. We've had 250 medical students participate, and we are actually in the process of expanding clinical disciplines. This year, we've added students from the School of Public Health, earning master's degree in public health, MD, MPH students, as well as clinical mental health counseling students and pediatric residents. We have this fall piloted an expansion with Resilient Coastal Georgia. We had 42 teens from Resilient Coastal Georgia participate, and we're looking forward to expanding that in the spring. We also piloted 2 Resilient Teens Club targeted on 6th graders at 2 middle school, Burt County in rural Georgia, and then Hornsby Middle in Metro, Richmond County, Georgia. Those schools, we did Hope Givers Live events earlier in the year, and so it was a natural progression to pilot the clubs there. Next slide. I just want to talk a minute about our partnerships. I mentioned Medical College of Georgia and Georgia Family Connection. Child Enrichment and the Child Advocacy Center is also a critical partner. All of our facilitators receive mandated reporter training. And this year, as we look into 2026, we look to deepen partnerships, train educators specifically, and parents and caregivers in community resiliency model and trust-based relational intervention. We invested in 2025 for 3 people to become CRIM practitioners and 4 people to become TBRI practitioners. And so now we're ready to launch those trainings in 2026 to our schools and to our parents. And so get involved with us by partnering with us, investing in our youth, or simply sharing the story. We know by helping our teens become more resilient, they become resilient adults, which then have thriving, resilient communities. And now I would like to turn it over to one of our partners with Resilient Coastal Georgia, Molly Lieberman, who is the Executive Director for Loop It Up Savannah.
Thank you so much, Rebecca, for that introduction and also for all of your wonderful work. It was such a pleasure for our community to get to partner with you guys this year. So thank you. My name is Molly. I'm going to be talking today both about our collective work with Resilient Coastal Georgia and also in a little bit more detail about Loop It Up Savannah's Mindfulness Zone program. But before we get into that, we're going to do another group question. This is a good one. What is something that you do to find your calm? So go ahead and put some responses in the Menti. Yoga for sure. Going outside, the garden, deep breathing, meditation, exercise, walking. These are good things. Oh, solo dance party, always good. Deep breaths, cooking, puzzles. This is like a list of things that hopefully we'll all be doing over the weekend. Time with my fur baby, me too. Horseback riding. I love it. Hopefully we can send out this list when it's all said and done in case anyone needs reminders of things to do. Thank you all for participating in that. So I'm going to start off by talking a little bit about Loop It Up Savannah, which is the nonprofit that I run. And then I'll move into talking about how our coalition works together to support resiliency and well-being in schools. So Loop It Up we're in our 18th school year this year. We're a youth arts and education nonprofit. We serve over 11,000 students every year. And our mission is providing groundbreaking programming designed to foster creativity, joy, possibility, and learning for the children of our community. So we work primarily in Chatham County, but thanks to our partnership with Resilient Coastal Georgia, we recently have begun building a partnership with the Effingham County School System, and we're working on building a partnership with the Bryan County School System as well. So we're so grateful for all of the partnerships that we have. Our programs happen both during the school day and after school. And we build very, very collaboratively with teachers and principals, counselors in the school. We never want what we do to kind of sit on the surface. We want it to really become part of the fabric of what happens within a school community. So we've been able to build all three of our core programs through direct partnerships within our school system. We have a early literacy program, which is an arts integrated literacy program that serves over 1,100 pre-K and kindergarten students every week. We also have a school garden program, which serves 37 schools throughout Chatham County. And then we have our mindfulness program, which is what we're primarily going to be talking about today. All right, we can go to the next slide. And hi to all my friends from our school system here. I see you guys in the chat, and I love you guys too. So we were very excited at Loop It Up to be able to join our Resilient Coastal Georgia Coalition back, I believe, in 2020. And what that gave us an opportunity to do was really look at the work that the partners at hand were already doing and think about how we could do a more thorough job building our collaborations to support our school system. So one of the subgroups or work groups that our coalition has here in coastal Georgia is focused on our work in the schools. So this slide shows a handful of the partners that are part of that work. There are additional partners that have joined the fold at this point, but we really wanted to work together to be the best possible partners to build coordinated and complementary services and experiences and provide support for environmental shifts related to climate and culture that schools were already working on. So this partnership really gave us a chance to both strengthen the individual work of each of these organizations, but also to grow into this web that is much better at partnering and supporting our school system. And we've been able to do that very responsively. We've been hearing directly from people that work in our schools. This is helpful. We need more of this. We need less of this. And each of the organizations that work together have really been very responsive and grown and evolved in ways that have been truly helpful to our schools. So the other thing about that that's been great for us to see is, sometimes I think as people running nonprofits, I'm sure I have many colleagues in the same boat on this call. sometimes there's, you hear of a need that is not exactly addressed by what you do, and you want so much to help, but there's really no way that your organization can take that on at that moment. So we've really benefited from having such a close network of partners that if there's something that we hear a school needs that we can't do it at Loop It Up, we have this very easy to access list of partners that we trust, and we feel we can reach out to help meet those needs. So that's been a really beautiful thing for us too. Perfect timing on the slide switch. Thank you. This graphic here on the right is from a couple of years ago, but I wanted to share it because it's by one of our local artists, Brittany Curry. She goes by Inky Brittany, and she's a graphic recording artist. So she takes visual notes. And one day we were having a conversation, all of the partners together, just listing all of the different programs that we collectively have embedded in our school system. And so she created this graphic to sort of sum up the wide range of support and ongoing involvement that we have. And we found through this conversation that at that time, and again, this is from a few years ago, we were collectively supporting over 50 of our 56 schools. So you can see that sort of broad impact that together partners are able to achieve, and we really can only do it in collaboration with each other. It wouldn't be sustainable on its own. So yes, we love this graphic too, and you can see logos of some of the various partners involved, as well as descriptions of the type of programming, services, and also environmental support that we are able to provide to our school system. So I'm going to shift, actually, if we can stay back on the previous slide for one more minute. Thank you so much. I'm going to shift gears a little bit to tell you in a little bit more detail about our mindfulness program. So we started this program back in 2019 at the request of one principal who was looking for ways to help her students have more better developed self-regulation skills because they had very high suspension rates in their school. And she realized that the reason this was happening was that kids just did not have the skills, and they were being pushed away rather than brought closer and learning those skills. So we started our first mindfulness zone, which has grown dramatically over the years to support over 20 schools within Chatham County. And we also are, as I mentioned earlier, starting to bring this program to both Effingham and Bryan counties. So we have a bunch of different ways that the program shows up in the schools. There's very hands-on versions of it where our staff is going in, doing weekly workshops, doing professional development and training with teachers. We also have our mindfulness zone setup program where we come in and set up a beautiful calm down space, which can be either in a classroom or in a space on its own that the whole school accesses. We also have developed versions of the program or layers of the program, which are really easy for teachers and counselors to implement on their own. We have our Mindful Monday cards, which just gives a simple practice of the week. And this is some of the data here that you can see on the screen from our survey that we did earlier this year. And we love to see these numbers. It's incredible to just recognize, like, when we pour in, kids really, really benefit. So we're grateful for such a thorough collaboration with our district, which allows students to benefit from these skills. All right, we can hop to the next slide. I wanted to talk a little bit in more detail about one of the partnerships that we've developed over the years. I don't know if are we able to advance to the next slide? It might be. There it is. Great. Thank you. So we've worked very closely with Vera Salzburn, who I think many of you guys know. So formerly, she was with Safety Net of Chatham County, but now she's with the Mediation Center. So two long-term partners of ours. But one of the programs that the Mediation Center now offers is this wonderful trauma-sensitive yoga program. So there's so many ways that TSY is coming into our schools during the day, after school, but we wanted to just really highlight this partnership because we have all this sort of foundation of mindfulness and focusing on well-being and self-regulation in so many of the schools through the Mindfulness Zone program and the Mindfulness Zone spaces, it has really led to such an easy connection of the dots for this trauma sensitive yoga program. There's, the spaces are already set up. It's very easy to come in and do yoga. And it's just been wonderful to see the way that our school system has grown and adapted to bring all of these types of activities in as something that we do. It's not something we do on the side anymore. It's something that is very much part of what happens in our district, to the extent that actually our district has put mindfulness zones in the construction guidelines. So when we're renovating schools and building new schools in Chatham County, spaces that are supportive of these types of activities for students and for teachers are really being centered as something that's a priority. So that's a big excitement that we have this past year when that came into being. All right. Well, thank you so much. Please feel free to reach out. We're always happy to share any of the resources that we've developed with other communities around the state. These images here are some samples of the posters that we have and our Mindful Monday cards. So those are really easy resources for us to share either digitally or, put some in the mail and send around the state. So thank you so much for all of you guys for learning about this, and also to Resilient Georgia for creating a space where we really can collaborate effectively across the state. Thank you. So without further ado, I'm going to be handing it over to our next speaker. Jade Reagan is the Special Projects Coordinator with United Way of Southwest Georgia, and she's going to be speaking today about the power of youth leadership and the Resilient Southwest Georgia Coalition.
Hello, everybody. Hi, Miss Angel. How are you doing? Good morning, everybody. Thank you all so much for having me. Thank you, Resilient Georgia, for having me today. Oops, sorry about that. And thank you to all the amazing speakers and Miss Molly. That was a great introduction. My name is Jade Reagan. I'm the Special Projects Coordinator here at United Way of Southwest Georgia. And today I will be presenting to you Youth United Teen Mental Health Coalition. So before we start, I would like to start off with a quick question. Currently, how is youth voice being uplifted in your organization or community? Is it mostly adult led, so they're not really encouraged to kind of lead? Are youth being asked their opinions or feedback, but you take into consideration? Youth participating in planning programs, they're very, very, very active, or they're leading these main initiatives? And no answer is wrong. I'm very familiar with the one that's getting the most views, the sometimes. Youth are definitely asked for their opinion. We know we all care about our youth. I think that one of the challenges are getting them comfortable with speaking and getting them to plan. Great. Alrighty, so what is Youth United Teen Mental Health Coalition? So Youth United Southwest Georgia is a youth-led coalition under United Way of Southwest Georgia that empowers youth to lead. So we believe in the mantra of giving them the paper and the pen, the information and the resources, but letting them plan their futures, letting them plan their initiatives, especially when it comes to mental health. So for those who might not be familiar, United Way of Southwest Georgia, we focus on 4 impact areas, which are going to be your education, your health, your basic needs, and your financial stability. Youth United touches on that education and that health of their teens. We believe that teens are one of the most impactful demographics that we have in our communities, because by teaching them, we're able to really touch a lot of different people. We're able to touch their parents, we're able to touch their elders, their teachers, and they are our future. So it's a youth-driven coalition that focuses on mental health awareness, leadership, and advocacy. We want them to walk in getting the information about mental health, leadership, and knowing how to lead and knowing how to make these programs or make things that make a difference in their community, while also being advocates for things that they think matter the most. We operate under Resilient Southwest Georgia Initiative. Thank you so much. We have loved working with you all because it really has helped us kind of expand throughout our 13 counties. It's led by teens, for teens. They're in high school, so they're going to be from the 9th grade all the way into the 12th grade, and they usually range from about 12 to 13 up into 18. We take anybody who's coming in late, who's maybe leaving a little bit later. We take everybody that we can. We promote safe, trauma-informed spaces through our campaign, school partnerships, evidence-based training and community events. So what we like to do is we take a selective group of students, we open our applications up to all of our counties, all the school counties, any school they go to. We open it up and then we take about 25 students. We started off about 3 years ago when the program first started with only 4 students, and we built throughout the year. And now we had up to 100 applicants last year, and we ended up taking 25 to 30 students. So we are able to grow tremendously. And what we do is we bring them in, we train them, we get them teen mental health first aid trained. We make sure that they come in with the knowledge of how they feel, what's behind that, and make sure that it's evidence-based. And then we also get them comfortable about talking about themselves, their issues, their traumas, and we do that. And then we let them plan how to help others around them, with the overall goal of bringing them back to the school, having them trained, educated, certified, and able to teach others around them. Because I'm not a teen. Y'all know I'm obviously not a teenager, but these teens have the power when they get the information to speak on their experiences and truly impact on a larger scale than what I feel as if I can do individually. So we host signature events every year. Our favorite events, the Hoodie Ball, You Matter Too, our annual Capitol Day. These are 3 events that have changed, honestly, the programming. And I hope to get into it a little bit more. I'm gonna get into it more later, but we also partner with schools. We don't just partner with, oh, if we can go back really quickly, I'm so sorry. If we, so we partner with schools, local leaders, mental health organizations, our faith-based, religion-based organizations. We partner with everybody, and it's a great program. If we can go next now. Alrighty, the impact of Youth United. So Youth United is fantastic. Like I said, we've grown so much in these last 3 years. I've actually been here for every step of the way. And we have touched over 26,900 students, community members, and just overall public by doing these social media campaigns. We have the whole month of May dedicated to mental health. These activities are year round. We are having the students doing podcasts. They have their own podcasts. They have their own social media. They have TikTok. They do things that make them happy. 100% of our direct participants, because once again, it's a 2-step program. I love it because you're getting these students in that are having hands-on work with us as mental health specialists. They're getting trained. They're walking out with these resume builders. They're feeling confident. They're amazing. But the best part about Youth United to me is that you do not have to be a direct student in the coalition to get the impact of the coalition. So these students are able to come in and they're able to touch others. We had 100% of our participants understood teen mental health, so they can speak on it more. They understood using these mental health strategies daily. They said they would even recommend Youth United to others, but they felt like they could even prevent violence in their own schools. You Matter Too is an event that we've done once again where students are able to come, they're able to talk in a panelist of students and youth professionals and teen professionals, mental health professionals that are able to sit with them and talk them through their feelings. And they're able to talk to the parents. We brought the parents, we include them, the elders, we tell them to come, hear what your student is saying, especially as summer break came in and we knew that they needed that communication. We go ahead and we give that to them in an evidence-based way. So y'all know how to communicate, y'all all know how to talk, and you all know how to talk to your parents about things that are difficult. We also brought them, yes, like the sneaker ball. Yes, but hoodies. Thank you. I see that comment in there, Miss Sonia Hope. I'll just skip to the hoodie ball really quickly, but the hoodie ball brings students from all different demographics, all different areas, and not everybody has a suit and tie to come and celebrate for the night, but they also don't have safe activities to do during the weekends either. So what we did is we said, hey, listen, we're going to have something that the students love. They wear those hoodies in the summertime, in the fall, in the spring. We're going to do something that caters to them while they can also learn about themselves and learn about their community. They can interact with their police officers. They can interact with their teachers, their students. Everybody from different demographics can come together. Really quickly, we did Capitol Day. We bring the students to the Capitol of Atlanta and we make sure that they can talk to the representative. We actually had them as pagers last year. So they were able to come in, they were able to learn about the system, and they were able to talk to people that really make a difference and feel comfortable, confident, and assertive from doing it. Thank you all so much. And then Teen Mental First Aid, we're training these students. They're coming in, and you can leave it here, you can leave it here. They're coming in and they're learning. They're being able to say, listen, this is evidence-based. This is how I feel. This is what I know. We're going to put it together and we're going to teach others because they're comfortable. Even right here, this is Miss Jaden. She came in, she's been a student the whole entire time. I work with her, I go to church for her, beautiful young lady, and she has opened up. These experiences have given her the confidence to be able to talk about her experiences. So what are our next steps? What are we going to do now? Like I said, we want to expand, not only just expand within the regions, we want to touch every region that we can within our 13 counties. However, we also want to add some diversity. We have a demographic right now that is kind of stagnant. It's been the same. We want to kind of invite more students. We want to get disability students in there. We want to open it up culturally. We want to make sure that all voices are represented well. We also want to expand within our region, like I said. We want to take the hoodie ball to you. We want to bring this opportunity to your county. We want to bring this opportunity to our surrounding partners. We don't have to just be the ones that are organizing it or our students, which they are the ones planning that, you all. That was their idea. They loved it. They were there every step of the way. We got the training for them, but we want to teach your youth how to do that too. We want to bring it to you. We want to strengthen our school partnerships. We also want to work with our community, our schools even more. There's counties that we live in Dougherty County. We're here in Dougherty County, so they're affected by us primarily. But we want to get into lead. We want to get into these surrounding counties that students don't get these opportunities. We also want to build our youth data leadership. We have committees in these youth teams. We have committees for them. We have planning so that they are primarily planning, but one of our most important ones is our data. We want our students to know what they're looking at. We want to know, hey, you want to do the hoodie ball, but how is it changing your community? What can we do to make this even more effective? What can we do to look at what we did last year, our CQI? What can we look at for quality improvement? What can we do and why are we doing it? Then we want to be sustainable. We want this to last. We want this to be not only in just Southwest Georgia, we want to expand this. We want to bring it to you. So we are so excited to be able to just expand. We want to help you all do this for your own teams. This is not our idea. This is our idea. And we want to bring this to you all. I can go on to the next slide. So thank you so much. Thank you all for having me. I am so appreciative of this opportunity to share with you all. If you have any ideas on what you want to bring to Youth United or how we can bring Youth United to you, please, 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 please connect with me. I'll be so happy to share any more information, photos, media, or most importantly, when we open up our next coalition. So I thank you all so much for having me. I'm so excited because I'll be now introducing Ms. Amira Abdulhafid. I'm so sorry, Miss Abdulhafid. I got you. And I'm so sorry, you all. Miss Felicia Hansel. I wrote them down so I can make sure I could say them. But thank you all so much for having me. And I'm so excited to hear what you all have for us too.
All right. Well, good afternoon. It's 12 o'clock. My name is Amira Abdulhafid. Thank you, Jade, for that wonderful introduction. And don't worry about the name. You did very good. I'm the program director for suicide prevention, and I will be presenting along with Felicia Hansel in just a moment. Hi, Gila. How are you, Gila? So we're going next. I am the program director for suicide prevention with a nonprofit called Guide. If you haven't heard about us, our mission is there on the screen to improve community conditions by utilizing collaborations, promoting positive youth development, delivering specialized training and resources, and preventing substance use and abuse. We did start in Gwinnett. However, a lot of our initiatives have expanded. We have kind of 3 areas that we combined with prevention work. So we'd have a lot of substance use prevention with the CDC's Drug Free Communities grant. And then suicide prevention, which is my area, we have 2 different grants and funding sources for that. That covers Gwinnett, Newton, and Rockdale counties. And we have a coalition that has about 100 partners on it. The Prevention Action Collaborative of Gwinnett that kind of helps us with all of our initiatives there. And then you can see we also have a youth advisory board because we can't be about the youth without their voice. So we have a youth advisory board that is made currently. This year's cohort is 29 high schoolers from Gwinnett County, 2 of which sit on our actual board of directors and go to the board of directors meetings to kind of report on what we're doing. They help us build projects, and I'll talk about that in the next slide when I get to it. Georgia Teen Institute, which we will be talking about shortly, as well as the Youth and Family Advisory Board, which is statewide as well. And then we offer many trainings such as evidence-based suicide prevention trainings, which I'll talk about, as well as many other trainings, which I don't have the time to completely talk about everything, but that's us in a nutshell. Next slide, please. So as I mentioned, our youth mental health initiatives do expand to Gwinnett, Newton, and Rockdale counties. I think the E got cut out there. I apologize. We offer evidence-based training such as QPR, question, persuade, refer, which is the 3 steps to save a life. Thank you, Kamisha. Youth mental health first aid trainings and conversations on access to lethal means, or CALM, and teen mental health first aid, which is just recent this year that we just started adding. We have been doing these trainings since 2019. To date, we have trained over, I just did the math, I'm sorry. We have trained in Gwinnett, I have not included overall in the 3 counties, we have trained a little over 3,500 in QPR. That includes all of our police departments in Gwinnett County, all of our fire departments in Gwinnett County. We know the first responders have high rates, and then they also serve the community, so we wanted to make sure we got in there. So, and every single month we are invited to the Fire Academy in Gwinnett County to train the recruits before they even graduate and before they even get out. So that way they have these resources before they start such a taxing job. Awareness campaigns, social media campaigns, billboards. You can see some examples in the picture. The one on the top is one I did a couple of years ago with some help with our partners on PAC-G. I'd be remiss if I didn't call out the Gwinnett Coalition for helping with everything that we're doing. They hold the Resilient Gwinnett initiative, and we partner with them on a lot of these trainings and other initiatives to spread the awareness as well. But as I mentioned, the billboards, you can see the 2 examples on the top and the bottom. The Touch of Positivity was an art contest that I did for Suicide Awareness Month last year. She was I believe a junior in high school, if I remember correctly, who drew that picture, and we put her artwork up on a billboard in Gwinnett County. That was popped around different counties. It was one of the virtual ones. So we had well over probably 1 million views on the billboard. And again, youth-led, youth started. We do have the wellness workbooks, which we tie into Georgia Teen Institute. And we do different activities with the wellness workbook, but that includes stress initiatives, how to cope with your emotions, the wellness wheel, breathing exercises. All of that is included in that workbook. And we like to hand it out to all of the teens and the youth that we serve, as well as the adults that take the trainings as well. So they can use that to kind of help the youth that they serve. So we do events. Guide to Wellness is our Suicide Prevention Awareness Month event that we try to do in September. And then again, our community partnerships with our Youth Advisory Board in Gwinnett County. I do have a cohort. Again, the whole cohort is 29, but I have a group of about 4 youth that are helping me build an ad that will be shown in the DMVs. They are creating it. They are doing the graphics for it. They're creating a storyline for it. And it's going to be like a 30-second PSA that will be shown in the DMVs. So that is something that we do with our youth so they can get their creativity out, get their voice out. And then I also work with a youth action team and partner in Newton County with the Newton County Drug Free Coalition. And when the Newton Community Partnership, they have a youth action team. I want to say it's over 50 youth who work on various different projects and run an annual project called Kick the Habit. They do it at their high school. And they run it, they lead it, they think of a theme, they come up with activities, and the school rotates classes, and each of them learn about different substance use prevention efforts, mental health, suicide prevention, different things depending on the partners that are partnering with us this year. So that you can't really see it in the picture, but hopefully you get a picture of the slides, but the picture with the youth behind the Guide to Wellness Fair graphic, that is our youth action team last year. They were recognized at one of the fall health fairs that we do in Newton County, and you can see that's just a fraction of them that comes there. So it's fantastic what we do working with these youth. We believe we can't be about them and do something about them for them without their voice and their input. So we try to include them in everything that we do. Next slide. So Georgia Teen Institute is one of our Guide's big flagship program. If you're not familiar with it, it is a week-long program that we do on college campus. Last year, it was held at Reinhardt College. It started in 1991, which has been going on for a little over 30 years. I can't do math off the top of my head, but a little over 30 years. It is a youth leadership program. Different youth action teams from across the state attend, and they get to stay on campus for that 5 days, where we teach them the strategic prevention framework, which is our framework that we use for our prevention projects. And the teams come together and we help them build their own prevention project to take back to their community. So for example, I know our youth advisory board in Gwinnett. Awesome. Well, we might be there next year. So have him, if he stays in the summer, Lamar, then we might be there next summer. But our youth advisory board in Gwinnett, their big project from Georgia Teen Institute is creating a health fair event to bring the community together to learn about the dangers of substance use as well as suicide prevention. And my Newton County Youth Action Team also goes every year, and their big project this year is raising awareness for mental health as well as talking to their county legislators about zoning and districting for the vape shops and the smoke shops that are popping up really close to schools. And we're trying to raise awareness of the dangers of that when it's really close to the schools. And this past year at Reinhardt was really special for us because we brought in a partner, the CWC Alliance, to do some workshops for our adult advisors as well as for our youth. And Felicia will be talking about that in a second. But Georgia Teen Institute is a very fantastic program. This past year, we had 140 youth attend. They're from all over the state, from South Georgia to North Georgia to East and West, and they build these projects and we help them throughout the year implement the project. If you have any questions, again, they're going to send a document out. I believe you could put it in the chat box. But I'm going to introduce Felicia Hansel right now. She's going to talk about CWC Alliance and how they worked with us at Georgia Teen Institute and what they do. Thank you.
Awesome. Thank you so much, Amira. I'm Felicia Hansel, the Youth Program Director at CWC Alliance. Really grateful to be here today to talk about our partnership with one of the regional coalitions, the one in Gwinnett County, as well as share some information with you about our statewide initiative with Resilient Georgia. But yeah, this past summer, CWC was able to partner with Guide at the Georgia Teen Institute. And we were really excited to get a touch point with the youth. In the photo on top, you see Carter and Cami in the CWC hat. But they were able to go and have workshopping sessions with the youth, as well as some of the youth advisors on substance misuse prevention and youth empowerment. We're able to have honest conversations about real life stories, and to be able to plant seeds and have youth lead action planning for prevention and wellness in their communities. And it was incredible to partner with GTI. We are hoping to partner again for the Georgia Teen Institute next summer. And on the next slide, I'll begin to share a little bit about the work that we're doing on a statewide level. So with Resilient Georgia, we have the Youth Prevention Network. It's a statewide initiative where our goal is to train 90 youth and 90 youth serving adults in a train-the-trainer model. I've heard it echoed many times today on this call that youth are the natural influencers. They are the natural leaders in their community. And so leveraging their influence and their strength and their input and their leadership, our hope is to positively impact over 7,200 teens across the state to build resilience and also build protective factors against substance misuse. We have two pathways. Our youth prevention advocates would be our teens who are leading the cause, the natural leaders who will create campaigns to reach their communities, as well as our youth prevention mentors. Those are our youth serving adults who really work to support teens. Those are mentors, religious leaders, leaders who are part of community-based organizations, our teachers. And so we're really excited to connect with partners across the state to be able to roll out this training. It's a strength-based one. If we go to the next slide, we'll see some of the inclusions in our curriculum. We utilize the backpack strategy where youth and youth serving adults can really strengthen their toolkit, right? So I'm going to put in my backpack all of the things that I'm learning, my skills, the knowledge building, all of the things that they can get through training, but also take out of their backpack some of the things that are unhelpful, like stigma and barriers or challenges that might exist, so that they can, as they walk around in the natural, like with their backpacks, be able to share resources, skills, and information with their peers, with even the people in their communities that might be older than them. We love the youth. I always say that our youth are the most important resource that we have, and it's really important to empower and equip them with the correct information, and to support their development so that they feel empowered to share in their communities. And so we have a 3 module curriculum that is focused on this idea or this slogan that we use of choose you, which was a choice from some youth that we work with at Ushers New Look. And the first one focuses on choosing yourself, not in a selfish way, but truly understanding self identity, some self care habits, and promoting that internal resilience, which will then translate to community resilience. The first one also includes an integration of the Trauma Resource Institute Community Resiliency Model and the Youth Ambassador Program that they recently rolled out. Really excited for that partnership, and they have just been tremendous. The second focuses on choosing your future. This is where we share the opioid and fentanyl education, but also refusal skills and decision-making strategies for our young people and choosing their voice. How do they take this forward? How do they impactfully share this with the peers? Helps them with communication skills and practical resources and leadership for them. I'm really excited for the work that we're doing. Thank you all so much for the time spent today. I will go ahead and, well, I do think we have one question before passing it off. And I think it's a great one that we can participate in to set an intention. What is one action you feel inspired to take to increase youth resiliency after today? I'll share for me, one of the actions I plan to take is reaching out to Jay to talk about this hoodie ball. I am so interested. I think it's so fun. So that's my action. Feel free to share. Connect with the Youth Prevention Network. Awesome. Would love to reach out and collaborate. Increase youth voice, volunteer. Awesome. Increase youth voice. Become a better listener. Connect statewide. Reaching out to Molly for Mindful. Awesome. Attend a summit. Oh, this all sounds amazing. And I think this really truly speaks to having forums like this where we can all share and learn about all of the things, the incredible things that we are doing with young people across the state to share ideas, get ideas, to help fortify all our programming. Thank you all. I will go ahead and toss it over to Emily Ann.
Hi, everyone. Thank you so much, Felicia. And thank you for all of our presenters. We're so grateful for everyone's participation in the meeting, but more importantly, we're incredibly grateful for all of the shared passion and work that everyone is doing in this space. As you heard today, we're prioritizing youth voice in our work, and we're excited to continue to do that with the help of all of you at the table. And we're just so thankful during this season of thankfulness to work and learn alongside all of you. So on behalf of the Resilient Georgia team, thank you for joining us today. Thank you for walking alongside us every day. And we hope that you will join us for our next general meeting next year, next spring, April 30th, 2026 at 11 a.m. again. Feel free to use that QR code to fill out our evaluation survey. and then be looking for another meeting invite from my inbox for April 30th. Thank you, everyone, and have a wonderful holiday season.